Dengue fever. Dengue fever is a mosquito-borne sickness that happens in tropical and subtropical spaces of the world. Gentle dengue fever causes a high fever and influenza-like indications. The extreme type of dengue fever, likewise called dengue hemorrhagic fever, can cause genuine dying, an unexpected drop in circulatory strain, shock, and demise. A huge number of instances of dengue disease happen worldwide every year. Dengue fever is generally normal in Southeast Asia, the Western Pacific Islands, Latin America and Africa. However, the infection has been spreading to new regions, remembering neighborhood episodes for Europe and southern pieces of the United States. Specialists are dealing with dengue fever antibodies. For the present, in regions where dengue fever is normal, the most ideal approaches to forestall disease are to try not to be nibbled by mosquitoes and to find ways to lessen the mosquito populace. Side effects. Numerous individuals experience no signs or indications of a dengue contamination. At the point when indications do happen, they might be confused with different diseases, like seasonal influenza, and generally start 4 to 10 days after you are nibbled by a tainted mosquito. Dengue fever causes a high fever, 104 F, 40 C, and any of the accompanying signs and indications. Migraine. Muscle, bone or joint pain. Nausea. Vomiting. Pain behind the eyes. Swollen organs. Rash. Most individuals recuperate within a week or so. Sometimes, side effects decline and can become hazardous. This is called extreme dengue, dengue hemorrhagic fever or dengue shock condition. Extreme dengue happens when your veins become harmed and cracked. Also, the quantity of clump framing cells, platelets, in your circulatory system drops. This can prompt shock, inside dying, organ disappointment and even passing. Cautioning indications of extreme dengue fever, which is a hazardous crisis, can grow rapidly. The admonition signs typically start the primary little while after your fever disappears, and may include extreme stomach pain, determined vomiting, draining from your gums or nose, blood in your pee, stools or regurgitation, draining under the skin, which may look like wounding, troublesome or fast relaxing, weakness, crabbiness or anxiety. When to see a specialist. Extreme dengue fever is a hazardous health-related crisis. Look for guaranteed clinical consideration in the event that you've as of late visited a region in which dengue fever is known to happen, you have had a fever and you foster any of the notice signs. Cautioning signs incorporate serious stomach torment, spewing, trouble breathing, or blood in your nose, gums, regurgitation or stools. On the off chance that you've been voyaging as of late and foster a fever and gentle manifestations of dengue fever, call your PCP. Causes. Dengue fever is brought about by any of 4 sorts of dengue infections. You can't get dengue fever from being around a contaminated individual. All things considered, dengue fever is spread through mosquito chomps. The 2 sorts of mosquitoes that frequently spread the dengue infections are normal both in and around human lodgings. At the point when a mosquito nibbles an individual contaminated with a dengue infection, the infection enters the mosquito. Then, at that point, when the contaminated mosquito chomps someone else, the infection enters that individual's circulatory system and causes a disease. After you've recuperated from dengue fever, you have long-haul insusceptibility to the kind of infection that tainted you, however not to the next 3 dengue fever infection types. This implies you can be tainted again in the future by one of the other 3 infection types. Your danger of creating extreme dengue fever increments on the off chance that you get dengue fever a 2nd, 3rd or 4th time. Hazard factors. You have a more serious danger of creating dengue fever or a more extreme type of the illness if you live or travel in tropical regions. Being in tropical and subtropical regions builds your danger of openness to the infection that causes dengue fever. Particularly high-hazard regions incorporate Southeast Asia, the Western Pacific Islands, Latin America and Africa. You have had dengue fever previously. Past contamination with a dengue fever infection builds your danger of extreme indications in the event that you get dengue fever once more. Confusions. Extreme dengue fever can cause inner draining and organ harm. Circulatory strain can drop to risky levels, causing shock. Now and again, serious dengue fever can prompt passing. Ladies who get dengue fever during pregnancy might have the option to spread the infection to the child during labor. Furthermore, children of ladies who get dengue fever during pregnancy have a higher danger of preterm birth, low birth weight or fetal pain. Counteraction. Immunization. In spaces of the reality where dengue fever is normal, one dengue fever antibody, Dengvaxia, is endorsed for individuals ages 9 to 45 who have effectively had dengue fever essentially once. The antibody is given in 3 dosages throughout a year. The antibody is supported distinctly for individuals who have a recorded history of dengue fever or who have had a blood test that shows past contamination with one of the dengue infections, called seropositivity. In individuals who have not had dengue fever previously, seronegative, getting the immunization seems to build the danger of extreme dengue fever and hospitalization because of dengue fever later on. Dengvaxia isn't accessible for explorers or for individuals who live in the mainland United States. Be that as it may, in 2019, the U.S. Food and Drug Administration endorsed the immunization for individuals ages 9 to 16 who have had dengue fever before and who live in the U.S. domains of American Samoa, Guam, Puerto Rico and the U.S. Virgin Islands, where dengue fever is normal. Forestall mosquito nibbles. The World Health Organization focuses on that the immunization is definitely not a viable instrument all alone to diminish dengue fever in regions where the ailment is normal. Forestalling mosquito nibbles and controlling the mosquito populace are as yet the principal techniques for forestalling the spread of dengue fever. In the event that you live in or travel to a space where dengue fever is normal, these tips may assist with decreasing your danger of mosquito nibbles. Stay in cooled or all-around screened lodging. The mosquitoes that convey the dengue infections are generally dynamic from daybreak to nightfall, however they can likewise chomp around evening time. Wear defensive apparel. At the point when you go into mosquito-invaded regions, wear a long-sleeved shirt, long jeans, socks and shoes. Use mosquito repellent. Permethrin can be applied to your apparel, shoes, setting up camp stuff and bed netting. You can likewise purchase dressing made with permethrin effectively in it. For your skin, utilize an anti-agents containing somewhere around a 10% centralization of DEET. Lessen mosquito living space. The mosquitoes that convey the dengue infection regularly live in and around houses, rearing in standing water that can gather in such things as utilized auto tires. You can assist with bringing down mosquito populaces by killing living spaces where they lay their eggs. Basically once every week, unfilled and clean compartments that hold standing water, like planting compartments, creature dishes and bloom containers. Continue to stand water holders covered between cleanings.